taken Dad to the doctor 3 times, and he does that little mini mental status exam and says, "Oh, he's not that bad. He's just getting old. You just need to relax and manage your stress a little bit better. Dad's not so bad." Well, the mini mental status exam is not a diagnostic tool. It's not meant to diagnose any kind of dementia. It's meant to give us an idea in that moment, a snapshot of their functioning. Are they oriented to person, place, and time? That's all it is. And you could give it to them at 8 in the morning and have one score, and give it to them at 3 in the afternoon and have a different score.
Absolutely.
What's that exam called?
The mini mental status exam. So it's a good tool. I'm not bashing the tool. I've administered the tool myself before. But we have to be careful we understand what the tool is meant to be. It's meant to just give us a snapshot of their functioning and their orientation.
A little evaluation.
Yeah. So when we know that people have instinct, intuition, and emotion, it makes sense to us that when they go to the doctor's office, intuitively, they're on their best behavior. Not intellectually calculated, I'm going to act this way for my son and this way for the doctor, because I don't care about burning my son out and I care about the doctor. That's too much high-level functioning for a brain with dementia.
Right.
That's too much calculation. It's just instinctive and intuitive. I'm in a formal setting, I've got formal behavior. And for those folks who use humor, these comedians, a lot of folks can banter all day long with the doctor. Doesn't mean any of the information exchanged is accurate. Right?
I had a patient, I don't want to interrupt, the situation with the doctor, I'm sorry to interrupt, but it was so fantastic. Dr. Wero was my patient's primary physician. Now, Norman had lost, I should mention his name, I'm sorry, but the patient lost his voice. He was at the point where he could not talk and not communicate with me. So we did banter quite often. It worked. Humor was a big one. And Wera had known him for a long time, but long story short, Wera said, well, he talks in German, let's see if he can talk in German. Wera started talking in German, rather in Russian. Norman started talking in Russian. Couldn't speak a word in English, couldn't speak a word to me, but when the doctor started talking another language, came out like unbelievable.
That's that long-term memory.
That's right, long and short-term memory. Right. But it was just, I stood there with my mouth open, I couldn't believe it. I couldn't get him to say yes or no, but he's talking in German. I was like...
And you got the doctor's name wrong.
Oh, sorry, well...
But that's a good point. And we'll talk
it was
about
Nick Sabitinoff, right?
We'll talk about why that happens. We'll talk about
I'm sorry to interrupt, but it just caught on me that was a good example of you know, being here but not being here.
Absolutely, yeah. And we also can't take for granted that what they're telling us in their native language is accurate either. Right? Because their brain is still not functioning, even though they're commanding that language. They may be just as confused in that language as somebody who speaks native English would be confused in English. But at least it was a sense of familiarity for that person, which is comforting, and we're going to talk about that. Absolutely. So if we can understand that people are operating out of instinct, intuition, and emotion, we have our foot in the door, and we can also be sensitive to family members. Just because this person is presenting this way with me right now doesn't mean that they're not having the issues the family is saying that they're having. Doesn't mean that this family isn't burned out. And, you know, I learned early on when I was working at the Alzheimer's Respite Center in Sonoma County, never, ever, ever assume that it's going to be a wonderful compliment to walk up to someone's daughter and say, I just love working with your mom. She's such a sweet, sweet woman. And someone start crying. Why is she nice to everybody but me? The way that they interact with us might be different than the way that they interact with family because of that intuitive understanding that this is a more formal relationship or I'm in a more formal setting. It's not, I hate my daughter and I want to make her life miserable and I want to be nice to everyone else. If that kind of calculation was going on, their brains would be working, right? But it feels that way sometimes to family. Sometimes really feels that way. Or the doctor says, you're fine, Mom, so why don't you tie your own shoes? You know my back hurts. You don't even care if my back goes out. When in reality, Mom just sounded fine. People will tell me, well, sometimes she's really, really lucid, and I'll say, sometimes she sounds really lucid.
Maybe the daughter should put on a lab coat.
There you go.
Wow.
I'm from the school of whatever works, right? I have told people since I was about 15 years old, it's okay, I'm a nurse. And I'm not. It's not about lying to them and tricking them and being sneaky. It's about helping them understand I'm a safe person and it's okay for me to be performing this personal care for you.
Right.
You say it in a context that makes sense for you. In the same way that we speak,
Hospice of
in the same way
Ukiah.
that we speak age appropriately to young children, we need to speak disease appropriately
Yes,
to
it
people
is.
with dementia. So let's talk about the different diagnoses and then we'll go from there. As you can tell already, I'm really casual, so if you have a question, you have something you want to say, just let me know in between. The first diagnosis
Absolutely.
I want to talk
Now,
about
do you
is
have the number
Alzheimer's
of our
disease,
thrift and
because
gift
it
store?
is the one that is most
And
commonly diagnosed.
just a second, I'll give it to you.
It's estimated that 50% of people over 85 have Alzheimer's disease. So a lot of people will tell me, well, why do I need to get diagnosis then if 50% of people over 85 have Alzheimer's disease? It's probably Alzheimer's disease. Well, 50% don't. So I still have a bias around knowing what we're working with, if you can. And I'm certainly not saying pressure the families.
Hello?
You know, if they don't have a
The
diagnosis,
number is
please don't pressure them
462.
to get one. That might just be more stress. But if they,
3141.
I think it's really appropriate for you to say,
ask
you know,
for,
do you know what's
Jeremiah.
causing your loved one's diagnosis? Have you had have they had
This
a
is
formal
Dr.
workup
Witter, I'm the
somewhere?
medical director.
And if they do
of
have
Hospice of
diagnosis, that's
Ukiah.
good information for
Yeah,
you.
yes.
And you can always call me, call our office, and we can send you more information
Dave
about
DeMille,
that
yes, he's
diagnosis
on-
or talk to you
he's on our
about
board.
it.
Yeah,
So that you feel
yeah,
like you're
yeah.
even more competent going into that.
Oh, wonderful. No, we
the first
will
one
be
is
so
Alzheimer's
happy
disease.
for that stuff.
Alzheimer's disease,
And-
you have a little handout. Everybody should have one. If you don't, we can make more. I know a lot of people came in after we
Oh,
made
God, we
the
don't have a
extras, and
truck
we can make
today.
more extras later. But if you don't have one right now, look on with someone. A map of the brain here.
Well, look, we'll go ahead and get
And
one.
just because it says lobes of the brain affected by Alzheimer's disease, we can use it when we're talking about other diagnoses as well, and I'll tell you how later. Alzheimer's disease causes what we call global
Okay.
deterioration,
Okay,
meaning the
okay, thank
whole
you.
brain is eventually affected.
And then, let me.
Some
give me
some
your
diagnoses
hello?
only attack certain parts of the brain. Alzheimer's disease eventually affects the whole brain. So all of these lobes are affected. If you look at that structure in the middle, that kind of looks like a boomerang, the hippocampus, one of the first things that we see go in people with Alzheimer's disease is that hippocampus. And if you look, the hippocampus is associated with memory and learning. So somebody brought up the concept of the long-term memory. People with dementia tend to maintain their long-term memories far past the point that they have access to short-term memories, if that makes sense. And that's because this structure in the brain, I'll explain it. And if it still doesn't make sense, bug me until it makes sense. That structure in the brain, the hippocampus, is responsible for storing short-term memory into long-term memory. Short-term memory is really like 30 seconds at the longest. So we hear sometimes that dementia is short-term memory loss, and that's not really entirely accurate. It's not short-term memory loss. It's the inability to store short-term memory into long-term memory. So those memories that have already been stored are accessible until that part of the brain breaks down. So somebody could speak Russian when they haven't spoken Russian for the last 40 years. But they might not be able to tell you what they had for breakfast this morning.
Absolutely, absolutely.
Somebody could tell you who their first grade teacher was, but they might not be able to tell you that they went to the doctor this morning. Does that make sense?
Yep.
No,
Because
not really.
those memories were stored when the hippocampus was working. This morning wasn't stored because the hippocampus was broken. So it doesn't make sense that it should happen.
No.
But I'm hoping that it makes sense to you why it happens. That hippocampus is like the save button on your computer. And I have to stop saying floppy disk. I always say, information's like a floppy disk coming in. It's more like one of those USB sticks. Yeah. And, you know, the new information is that SD card going in, and the hippocampus saves the information to the hard drive. So when you take the disk out, it's still there in the hard drive. The save button doesn't work anymore.
Right.
So how come Mom can do this, she remembers this, she remembers that, she remembers this, she remembers that, but she doesn't remember my back hurts? And she wants me to carry all her stuff for her? Save button doesn't work. Does that make sense? So people are basically unlearning. They're kind of going back in time. Eventually, access to those longer term memories will start going away as the brain continues to deteriorate. With Alzheimer's disease, there are 3 processes going on in the brain. One is that we see lower levels of the neurotransmitter acetylcholine. Now, neurotransmitter is just a fancy word that means chemical ferry boat. So I don't have a board, but I'll just, if your nerve cells kind of look like my arm, if I put another hand on the end, you've got a long axon. This part is called the axon. And on the end of the cell are dendrites that kind of look like fingers. And the way that impulses go from your brain to your body or from your body to your brain are by chain reaction from nerve cell to nerve cell to nerve cell. However, the nerve cells don't touch each other. They're not like this, shooting down a line. They're like this. So something's got to get the message across that space. That space is called the synapse. We've all heard that word. Her synapses aren't firing, right? Well, the synapses are the space between nerve cells. So the message goes down the cell, out the dendrite, and gets picked up by a neurotransmitter, a chemical ferry boat that ferries the message across the synapse and drops it off at the next cell. So there are different neurotransmitters for different functions. Acetylcholine is the neurotransmitter associated with memory. And in Alzheimer's disease, we see lower levels of acetylcholine. So that's why medications like Aricept, Exelon, galantamine, these what we call cholinesterase inhibitors are around to help boost the levels of acetylcholine in the brain. Right? Cholinesterase is the enzyme that breaks down acetylcholine. So if we can inhibit cholinesterase, less acetylcholine is getting broken down, and therefore more is available in the synapse to ferry those messages across. Does that make sense? So that's what those medications do. And they were never intended to cure it, and they really weren't intended to make it better. A lot of people will say, oh, they went on Aricept and they're so much better. And I wonder about that, because that was never the intention for the medication. What they were intended to do was to delay progression. And that's kind of up in the air. That's hard to tell anyway, because we don't have a clone of that person as a to compare them to. So we don't know how it would have progressed anyway. You have a question?
So question, are there foods that one can take prior to becoming old and possible dementia to help,
Yeah, they're not to cure it, not to reverse it once you've got it, because it's a disease process, right? But really they say anything that's healthy for the heart is healthy for the brain. So if you're looking at preventing dementia before you get it, or delaying onset, eating a heart-healthy diet is a brain-healthy diet. Good question. So,
The doctor mentioned to me when the patients I was dealing with was taking those medications, he said 10%. He gave me 10% of, and that was, and that's pretty minimal, but as you say, delay was only 10%. I asked him about the percentage of increase of how it would delay it because taking those medications, and he shook his head and said 10%.
and we'll talk about why. So that was one. Remember I said Alzheimer's disease has three different processes.
Right, sorry.
So one is lower levels of acetylcholine. That's what the medication's trying to boost. Another thing that happens in the brain of a person with Alzheimer's is that inside the nerve cell gets all tangled up with what we call neurofibrillary tangles. Those tangles have a toxic protein called tau, T-A-U, tau protein, which consumes the brain cell from the inside out. The other thing that happens is that we see beta amyloid protein that encases the outside of the cell. That's the plaque. You've probably heard plaques and tangles. The plaque is the beta amyloid protein that encases the nerve cell, and it is also toxic and consumes the cell from the outside in. So people's brains literally end up with holes in them. And so after a while, it doesn't matter how much acetylcholine we've got stored up in those synapses. If there's not a channel for it to flow through, it's not going to be helpful anymore. So that's why we see those medications stop being helpful after about a year, 18 months or so. There is some suggestion. I talked with Ron Finley, who's one of the pharmacists at UCSF Memory and Aging Clinic a while back, and he said there is some evidence to suggest that those cholinesterase inhibiting medications, Aricept, Exelon, galantamine, those sorts of things, are helpful in combination with certain medications like SSRIs or antipsychotic medications in helping to manage some behavioral issues. And they, at the point that I talked to him, they didn't know why. So we don't suggest people just go off cold turkey, but we do suggest if people are thinking, mom's been on this for 6 years, is it worth the money to keep paying for it, and it's hard and I gotta cram it down her throat every day and she fights me, she doesn't want to take it, it might be worthwhile to talk to the doctor about going off. And this is not our role, as hospice volunteers, but there are some folks in here who have family members, so I think that's important.
About going off of what? What
About going off of those medications.
The Aricept stuff?
Yeah.
And then you mentioned antidepressants or something?
Mm-hmm. Later on, sometimes antidepressant medication or antipsychotic medication can help with hallucinations, with sleep disturbances, combativeness. And that would be something to talk to the doctor about. How can we coordinate that? Or talk to a really good pharmacist, like the one at UCSF is great.
So this nerve business must be why it was always said that a person had to die before they could determine if it was Alzheimer's because of the
Because they want to see, the autopsy identifies those plaques and tangles. Mm-hmm.
Oh, okay.
That's what they told us when we took our patient to the neurologist. He said he couldn't tell for sure unless he did a biopsy of the brain.
And a neurologist by himself probably isn't in a position to make a definitive diagnosis without neuropsych testing and other data. But you can get pretty close. The diagnostic centers, UC Davis, UCSF, Stanford, California has a number of dementia diagnostic centers. They're within 95 to 98% accurate. So certainly for 100% diagnosis of Alzheimer's, you still need that autopsy or biopsy. But 95 to 98% accuracy is pretty darn good because they're ruling out other causes. It's not any of the reversible things we talked about, we ruled those out. And it's not any of the other types of dementias because we ruled those out. So that's kind of how they arrived there. You had a question?
It doesn't matter, But my understanding was that they had developed some new scanning techniques to do diagnostics.
They can do some PET scans that are pretty,
Right.
you know, in Berkeley they have a great PET scanner that does some really, really high resolution scans. That's pretty accurate, yeah. Still, I think they're saying 100% is on autopsy, but I think 95 to 98% is
But a
pretty
diagnosis
good.
doesn't solve a problem.
Diagnosis doesn't solve
But
a
it helps.
problem, but it does solve the problem of knowing what you're working with. Right? Because we're going to talk about some other diagnoses as well. So for people with Alzheimer's disease, the trajectory can kind of be all over the map. And it might look, you know, you might say, oh, my neighbor had Alzheimer's, so I got this. But your neighbor's Alzheimer's might not look like your father's Alzheimer's, even though it's the same diagnosis. There's lots of variability within that same diagnosis because depending on onset, depending on the pattern of the progression, symptoms can be different. Some people's frontal lobes are affected first. And so if you look at your brain, we might see more impairment in personality changes, reasoning, judgment, inhibition. I had somebody I was working with whose wife was misdiagnosed as having frontotemporal lobe dementia. And on autopsy, they found out it was actually Alzheimer's. But her frontal lobe was affected first. So her behaviors that manifested first looked like the progression of frontotemporal dementia. After a while, people with Alzheimer's are basically going to have any and all of the symptoms that we see with any of the other dementias, if that makes sense. Because after a while, their whole brain is affected. So it can be all over the map too. So, you know, people might progress really quickly. In fact, early onset, like onset in 50s, 60s, tends to move more rapidly and more tenaciously. Onset later in life, 70s, 80s, 90s, tends to progress more slowly.
Just gonna go outside and get some water.
Sure.
Thanks.
Do you have a question?
I do. I've heard that, you know, Alzheimer's is more affecting of like the movements, body functions, those kind of things, or dementia is more the brain. Is that not true?
No, dementia, Alzheimer's is dementia,
Okay.
right? Alzheimer's is
It
a type
is a form
of
of
dementia.
dementia.
Right.
So,
So Alzheimer's will, your movement of your body will eventually be affected because your brain controls everything.
like my aunt has losing the ability, you know, the ability to feed herself, and she can't walk anymore. Where my dad, he has, you know, severe memory loss, but he can function physically.
Sure. And they might have different diagnoses, but it might just be that variation in progression, right? The part of her brain that deals with movement,
Bless you.
here, might be affected, whereas your dad's might have been spared at this point. Does that make
Okay,
sense?
yes.
And her frontal lobes might not be as affected, but his might be. And we're assuming they both have Alzheimer's. They might have another dementing illness, right? They might have two different kinds.
Yeah, my dad's doctor just says he has severe memory loss, and it's like.
And you could have
whatever.
told him that, right? You already knew that. So, you know,
Severe that he doesn't remember his kids and those kind of things.
Right,
So,
right.
you know.
So you didn't need a doctor to tell you that, right? You need.
What is the difference in fast and slow? You said some regressions faster at
You know,
certain ages, some slower.
I don't know that they've identified the difference. What makes that difference?
It sounds like age onset.
Onset, we do know. So if somebody gets it earlier in 50s or 60s, it tends to go really quickly.
Do we know why?
I don't think we know why yet. No.
That's what I wondered, what
Yeah.
quickly meant.
Right.
What is quick?
Maybe 5 to 10 years rather than 10 to 20 years.
Okay.
Does that make sense?
Mhm.
Yeah. But I don't know what I don't know that the factor that determines the
No.
speed has been identified.
Somebody somewhere said that in the end of all time, this stuff, that the brain doesn't tell the body to swallow.
Right.
Oh, yeah.
And that's
Oh,
the last
yeah.
thing, right?
Your whole brain, your brain
With this
affects
disease,
every
right?
function
Is
in your
that
body.
true? Oh, okay, I
So,
didn't know if that was really true.
It affects every function in your body. So if
Okay.
people live long enough, eventually, people who die of dementia, right,
Mhm.
die because those autonomic systems shut down.
That's right.
Because your brain stops telling your heart to beat. Your brain stops telling you to breathe. Your brain stops your telling your organs to function.
Okay.
Most people die from something else first. A heart attack, a
Yeah.
stroke, asphyxiation, you know, those sorts of things.
So then
So that's true.
dementia would be identified as a secondary source of death then, not primary.
Well,
On the death
if
certificate.
they die, yeah, if they die from something else. Yeah,
Okay.
yeah.
That's why they
But
say you don't die of Alzheimer's.
You do, you can,
But
but most
because
people
you
don't.
die from that Alzheimer's stops your heart.
Yeah.
But you died from the heart, not from, yeah.
We also, if your heart stops beating because your brain stopped telling it to, you've died from Alzheimer's, because your
Yeah.
brain stopped telling it to
Depending
work.
on which.
If your heart
who's
stops
saying
beating
that.
because you had a heart attack, then you died from a heart attack. Does that make sense?
Yep.
Most people die from something else.
But if you
Aspirations.
don't, Alzheimer's is fatal then? If
Yeah,
you-
absolutely.
If nothing else, if you
Absolutely.
don't die from something else?
Absolutely. Because your body can't live without your brain telling it to run.
Nice brain, nice brain.
So if your brain eventually breaks down,
Right.
nothing's there to tell your heart to beat. Nothing's there to tell your kidneys to function.
Or
Nothing's
tell
there
you
to
to
tell you
breathe?
to breathe.
What's the most
Like when you're
common?
sleeping or,
Aspiration. I said asphyxiation. Did anyone catch that?
Yeah, I
I
did.
meant aspiration.
Oh, okay. And the 5 to 10 year was, if it
she's
starts in the
still
50s,
firing.
the 10s,
Still
20s, and it
firing
starts in
up
the
there.
60s? Oh my gosh, I could live like that for a very long time. Oh, Lord.
So this is the brain of a person,
Oh, wow.
a normal, healthy, old, elderly person's brain.
Oh, goodness
Pink cauliflower.
sake.
Yeah.
Yeah, almost.
Strawberry.
And this is the brain of a person who died from Alzheimer's disease.
Oh, yeah.
Oh, my. Eats away.
Yep.
Oh, dear.
No. What is
So
the-
quite,
What is the blue in the brain?
that's just the background. This is
No.
just set on a
Right,
blue
right where you're
background.
putting your fingers. You're
Holes.
right
This
in
is
the
a
middle.
hole. These are holes
Yeah.
in the brain.
It's the hole in the brain.
Yeah, it's on a blue piece of paper. The brain is on something blue.
Okay.
So if you see blue, that's a hole
The
where
cells
the
are gone.
background's showing through. Remember those neurofibrillary
Yeah.
plaques and tangles have the tau protein and the beta amyloid protein that consume the
So
cells.
literally disintegrate.
Literally Swiss cheese. I mean, we say Swiss cheese brain joking.
Oh,
Quite literally. So this brain is capable of being manipulative, being stubborn, being selfish, being mean, and this brain's just getting through the day. Even if the behaviors don't change, or most of the time, difficult behaviors become more of the same. We call them the more-sos. Sometimes people do a 180 and become kind of a different person, but a lot of times what's so hard is he's always been really self-centered. He's always been really stubborn. So I don't know about that. I don't know if it's a disease. I think Dad's just taken me for granted. When the truth is, to take someone for granted, you have to have like a plan. If you want to push someone's buttons, you gotta
know which button,
you gotta have some executive functioning, right? You first have to watch and figure out what the buttons are.
that's true.
Then you have to come up with a plan to push them.
That's true.
Yeah.
So,
Then you
Find what the
have to
buttons are.
execute the plan and remember to keep doing it.
Yeah.
Okay.
This brain's not functioning at that level. This brain could. This brain could be a mean, malicious, manipulative, selfish, stubborn
Oh,
person.
my goodness, yeah.
This brain could have all of those same behaviors without the intent behind it. Same behaviors, still difficult, but the intent is survival. I'm getting through the day.
Oh, Lord.
And I'm going back into my instinctual MO If I was manipulative and stubborn to protect myself when I felt threatened before, that's what I'm gonna do now. Not because I've decided to, but because instinctively that's how I keep myself feeling safe. Does that make sense?
Yeah.
It'll make more sense later on. You have a
Could you
question?
elaborate on the term executive function?
Yeah, those frontal lobe,
Frontal lobe.
those frontal lobe things, reasoning, judgment, those sorts of things, problem
Okay.
solving,
Okay.
abstract thinking.
Mhm.
So a person with Alzheimer's cannot be put to death in Oregon by their own wishes because they don't have the wishes, right?
I don't,
Because you can't accept-
unless they, you know, I'm guessing here, because I don't live in Oregon, I'm not up with that law. I'm guessing if they say before they're diagnosed,
Yeah.
if they
No.
say,
10 years
if
before
I
something.
get Alzheimer's, please do this, I would think that they would speak to
6
that.
months to live.
That's why in California with advanced healthcare directives, we want people to get them done before they're too confused to get them done.
Right.
Yeah.
Right.
Because after the
I
fact,
think
then,
that's it there, yes.
So,
You know.
so physician-assisted suicide is not possible
Can't be
in
fixed.
Oregon. It's considered euthanasia. There's a whole legal treatise on that topic, not the
yeah,
germane, but
yeah,
so
and
it's
we could.
very tricky. Yeah.
Yeah, we could go down that road, but we don't have time for that. But basically with legal issues, you wanna make sure you got your ducks in a row before you're too confused, no matter where you live.
Yeah.
You know, the laws are different with what's available to you, but you wanna make sure your ducks are in a row before, so nobody can say, she coerced dad into doing that,
Yeah.
right? So the next most common kind of dementia that we see is vascular dementia or stroke-related dementia falls under that umbrella. Somebody over here said hardening of the arteries.
Yeah, that's what we used to call it. I thought it was dementia. They just
Well, it can be.
Yeah.
Hardening of the arteries can be associated with that vascular dementia, right? So there's stroke-related dementia caused by a massive stroke, a CVA, we might call it, a cerebral vascular accident, a massive stroke, and the after effects of those depend on the location in the brain, right? Look at your map. So if I have a stroke in my occipital lobe, my symptoms are going to look different than if I have a stroke in my parietal lobe, right?
Right.
So after effects depend on the location in the brain,